program should be one that the organization can take pride in. It should be closely connected to the organization mission, built around delivering care to patients, delivering on quality service to the constituents in the community. And that should be reflected in the security program from the moment someone walks in the door of an emergency department, when often their first point of touch with a healthcare organization is the security officer. That security officer should be customer focused, should be helpful, should be understanding that the person may be under stress as they enter the hospital, should be empathetic, should understand the hospital not only geographically but what the services and the programs are, so that the first point of contact for the customer is a positive one, because that security officer is going to reflect everything the organization stands for. And again, people can feel when the person's not connected to the organization, right? And if your program isn't firmly embedded in the organization, if it isn't entrenched as a critical piece in support of patient care, it's not going to be effective in a healthcare organization. We're really focused on healthcare, right? We're a healthcare-centric organization, as some would say. Some organizations, security organizations, choose to be generalists. We've taken the specialist route. We focus on specialized niche markets, like healthcare, like campuses, and other focus markets. And we develop training programs specifically for those markets. And we bring in expertise into our organization for folks who have worked in those markets, who've been educated and trained in those markets, and healthcare is no exception. So unlike any other organization, we have healthcare firmly embedded in our senior management team at every level, from our ownership group to our vice presidents, to our directors, to our managers. Many of them have significant experience in healthcare. So they understand when we're responding to an RFP for security. They understand healthcare. We don't have just one or two experts. We have an organization of folks who understand healthcare and understand some of the differences that I've talked about earlier in the interview. And for us, it's critically important that we continuously train these folks, because healthcare is ever evolving, right? As many industries are, but healthcare is ever evolving. So we take a lot of time to ensure that our management team are trained in healthcare. So all of our managers across the country are trained in the essentials of healthcare security management. They're trained in healthcare emergency management. They're trained in designing a secure healthcare facility.